Hello, this is Bryson Flowers, and for my HIIM 360 Week 4 Assignment 1, I have decided to highlight issues in ICD-10. So for my assignment, I found two different articles discussing various problems within ICD-10. Both of my articles came from the HIIM Book of Knowledge. There were a lot of good articles on there, but as I read through most of them, I liked these two the best. The first article had to do with ICD-10 CM coding guidelines, especially looking at the long-term care facilities. And the second article was titled Providers Condensed Resource for Coding Tools and More. In the first article I decided to dive into, it discussed ICD-10 guideline issues and how they can be mixed up easily. It looked into long-term care facilities and how ICD-10 is used. ICD-10 guidelines are a standard that is to be followed by every medical coder that is employed within a medical organization. Coding guidelines are important for many reasons. By following these different guidelines, we can assure every medical coder is entering codes the same way. The purpose of these guidelines is to help different healthcare providers label certain diagnoses the correct way every time. If everyone coded and used personal procedures or mixed up the steps, there would be no consistency in our healthcare and our coding would be off. I like to think of this as a chef making a meal. If they use different ingredients throughout the process of making the meal, they will get different results almost every time. That's why they have a standard and follow instructions to get the same result. In this article, it looked into acute versus chronic care conditions. For example, a primary diagnosis is usually used to indicate the reason for Medicare services, which is sometimes not the reason for the patient's long extended stay. For example, a patient could be checked in and then during their stay develop new symptoms and health problems during their time of treatment. Some patients may develop diagnoses like pneumonia or bronchitis that were not present when they were admitted. Another important issue on guidelines is staying up to date. The guidelines are updated almost every year, so it's important to receive continuing education to assure that we are giving the patients the best quality of care. In the second article I chose to look into and read about for this assignment, it discussed the ICD-10 medical coding guideline problems within an EHR. It is no secret within the recent years we have made great strides in technology, and the EHR is just one good example. The electronic health record is very important to us because it allows us to access patient medical history and information whenever we need. This health record also allows us to limit who can see this private information. By using the virtual health record, we can also increase our accuracy of patient medical information. When using the ICD-10, there are 4 special guidelines, and they differentiate between inpatient care settings and outpatient care settings. When using inpatient care, we use the ICD-10 CM codes to explain how the patient's visit went and the time at the facility. The inpatient care brings MSDRGs into play, which is classification used to group and repay people for their stay. When we are in outpatient care, we use ICD-10 CM codes and HCPCS codes. When outpatient is used, we are coding different services and different supplies and equipment used. It is important for providers and employees to understand the difference between inpatient and outpatient so we can get the correct amount of reimbursement to the patient and providers. In conclusion, medical billing and coding is a tedious and important process in the healthcare industry, and without it, there would be a world of confusion. ICD-10 allows us to track and follow conditions and diagnoses that are seen every day in the healthcare industry. We must remain accurate and follow all necessary guidelines to be successful and well-rounded.